All right, today we're talking about something pretty huge in the fight against a really aggressive form of breast cancer. It's a story about cutting-edge science, some stark economics, and most importantly, a massive dose of hope. So let's start with a number, 20%. That's the slice of all breast cancer cases that are what's known as HER2 positive. And, this isn't just some dry statistic. This type of cancer is known for being really, really aggressive. But here's the thing. The science we have to fight it, it's just as powerful.
So if we have these amazing treatments, what's the problem? What's the biggest hurdle standing between a patient and the care they need? Well, it usually comes down to one single, really tough thing. And that thing is cost. It creates this awful paradox, right? We have the medicine that can save lives, but it's locked away behind this massive price tag. We're literally talking about the high cost of hope.
I mean, these therapies are incredible. They're life-saving, but they've always come with just a staggering price. So for so many people, especially in a place like India, it's like the best treatment in the world doesn't even exist if you can't get your hands on it. That's just a devastating reality to face.
But, and this is a big but, the story doesn't stop there. Something new is happening that's trying to just smash through that barrier. This is where we get to the real breakthrough.
And that breakthrough has a name, Tishtha. It's a new drug from the Indian company Zydus Lifesciences. And you have to understand, for thousands of patients, this name is everything. It's an affordable, effective treatment they thought they'd never see.
Okay, so what's the secret sauce here? What makes Tishtha such a game changer? Well, it all comes down to the science. And to really get it, we need to talk about a word you're going to hear a lot more about, biosimilars. First off, Tishtha is what's called an antibody-drug conjugate, or ADC. Now, the easiest way to think about this is like a biological guided missile. Seriously, this thing is designed to hunt down cancer cells and only cancer cells, and then deliver this super powerful medicine right to their doorstep. It leaves the healthy cells alone. It is precision medicine at its absolute finest.
And that brings us back to that word biosimilar. See, Tishtha is a biosimilar of the original drug, which is called Kadcyla. Now let's be really clear here. This is not some cheap knockoff. A biosimilar is a super similar, heavily tested version of the original. There are no real differences in how safe it is or how well it works. Think of it like a certified, top-tier alternative that just happens to cost less to make.
Okay, the science is really cool, right? But the real story, the one that actually matters, is what this means for patients and their families. So let's look at the numbers, because they are stunning.
This really puts it in perspective. You've got the original drug Kadcyla with its incredibly high price tag just weighing everything down. And then on the other side, you have Tishtha. It's launching at 32,495 rupees for a vial. That's not just a lower price. It's a price designed to completely rewrite the rules for patients in India.
So what does that price difference actually look like? Well, it looks like this, 80%. Tishtha is launching at a price nearly 80% lower than the original. And listen, that's not just a sale price. For a patient, that is the difference between getting treatment and not. It's a total lifeline. And this story is bigger than just one drug. This launch is actually a huge part of a much bigger plan, a mission by Zydus to make these life-or-death medicines affordable for everyone in India.
You can really hear it in this quote from their managing director, Dr. Sharvil Patel. He calls it a critical step in their mission for affordable, life-saving therapies. And then he says they hope Tishtha will bring a new standard of care. That tells you everything, doesn't it? This isn't just about profits. It's about raising the bar for what's possible in healthcare.
And believe me, Zydus is going all in. They already have one of the biggest biosimilar portfolios in the country. And get this, they have more than 25 others in the works. They are putting themselves right at the front of this whole movement, trying to change how we get access to these complex, modern medicines.
So when you zoom out, the story of Tishtha makes you wonder, right? This is a huge deal for India, for sure. But it points to something much bigger. Could this biosimilar revolution be the key? Could this be how we finally unlock affordable, high-tech healthcare for everybody, everywhere? It's a pretty hopeful thought to chew on. Thanks for joining.